For many patients, the journey to achieve control of blood glucose levels usually feels like an endless battle. From declining health, frustrations, and the fear of lifelong dependence on drugs, many patients usually feel overwhelmed. However, if this is your case, worry not, because I have a message of hope for you. Around the world, bariatric surgery, also known as metabolic surgery, is a fast-growing game changer in the management of obesity and type 2 diabetes. Beyond helping in excessive weight reduction, it also triggers powerful hormonal and metabolic changes that improve blood sugar control and reduce the risk of complications like stroke, kidney disease, heart diseases, and fatty liver diseases. My name is Reagan, a medical clinician and a clinical researcher with a focus on diabetes, metabolic health, and emergency medicine. In my daily practice, I manage and follow up patients living with diabetes and other chronic conditions. So what I'm sharing with you is not just theory, but real practical experience from the front line of patient care. If you're serious about understanding your health, preventing disease, and practicing smarter medicine, please hit the subscribe button now and join this community. In this video, you'll learn about bariatric surgery, the eligibility criteria, benefits, risks, and the complications of bariatric surgery. Let's get into it after the short introduction.
Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho. Moyo wa mwanadamu hukumbuka raha ya jana na kusahau utumwa uliomkaza kwa kamba, kwa sababu ya hofu ya kesho isiyoonekana. Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho.
Again, this is a continuation of the previous videos we've done about bariatric surgery. If you have not watched, you can watch them. However, I'll still define bariatric surgery for the new viewers. Bariatric surgery or metabolic surgery is a surgical intervention that helps individuals lose weight by modifying the digestive tract. The procedure usually serves to restrict food intake, reduce nutrient absorption, or both, depending on the surgical procedure that has been performed. So who is eligible for bariatric surgery? That is our main question today. The first class of people are patients with BMI greater than 40 kg per square meters. These patients need bariatric surgery because they are way too obese. The second class of people are patients with a BMI greater than 35 kg per square meters and with metabolic disorders such as type 2 diabetes. These patients also need bariatric surgery. And then the last class of people I'm giving you today are patients with a BMI between 30 and 34.9 kg per square meters, but with severe and controlled diabetes, especially if you have tried the nutritional, lifestyle management, and pharmacological interventions, and you feel you're overweight but still your BMI is between 30 and 34, then you also need bariatric surgery. So those three classes of patients need bariatric surgery. Before undergoing bariatric surgery, doctors also need to assess the following conditions on patients. Number 1 is psychological readiness. Number 2 is the capacity of insulin production. Number 3 is the duration of diabetes and treatment options that have been explored. And the last part is the commitment to lifelong follow-up. Let's also look at the benefits, risks, and complications of bariatric surgery. Bariatric surgery is fundamental in improving multiple obesity-related conditions. Among major benefits of the procedure include high blood pressure improvement is number 1, fatty liver disease improvement and prevention, reduction in blood cholesterol levels, sleep apnea improvement, reduction in cardiovascular risks, and lastly, joint pain improvement. As with other surgical procedures, bariatric surgery carries risks and complications as well. As a patient, you need to be properly informed and consent properly sought before you undergo this procedure. Among the potential risks and complications of bariatric surgery are the following. Number 1 is bleeding. You may bleed just like any other surgery. And then nutritional deficiencies, because the ability to absorb nutrients may be impaired. Number 3 are infections, and then bowel obstructions, blood clots, dumping syndrome, and gallstones. We can talk about these later in another separate video. You need to follow me so that you don't miss these Long-term use of supplements will be necessary for all patients undergoing bariatric surgery. Among the nutritional supplements that may be needed are the vitamin B12, calcium, iron, and vitamin D. Patients who have undergone bariatric surgery still need lifelong monitoring for any signs of recurrence and to avoid complications. In my final thoughts, metabolic surgical procedures have transformed the treatment landscape of weight loss and type 2 diabetes-related obesity. If you're struggling with poorly controlled diabetes and obesity, you can now access bariatric surgery as an evidence-based treatment option for improving both metabolic health and your quality of life. Once again, if this video gave you clarity, if it challenged how you think about modern management of diabetes and bariatric surgery, please subscribe now, because this channel is all about helping you stay ahead of the disease and not reacting to it. Share this with someone who may need it, because you may just change their lives. Diabetes doesn't start in the emergency room. It starts silently, and the earlier you look, the more you can change the outcome. Thank you.
Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho.